also movie and a swati and Kuala Mundi in Funo movie and a swati and no say very so should I say a never be breed a can boom massadiano it's me a tibasso ebi wo hɔ a ne maybe to say bia enuro kakra bia o se nya no koy hospital no a swati or send ben e paso a e be here hwe ne ma bebre em hwe say ya mo betie anso aba form ebi nso hɔ a akosoro ni maybe wo hɔ a universal health coverage nipa ba omo yare omo ba sen na akọ ye kan say ebi antibiotic duro kwa me ntwa antibiotic ma we bi en eswati ana ampa eswati ene ne awade aba be kan wi ani atranse atwinse mo hono kwa baba so a betime of course na health workers are all brain drain nurses are called doctors are called nyina kwan ben ne be fa so a ye betime si ho kwan ben ne be fa so a omo mo kɔ no kwan ben ne be fa so a be hye edi be shim ama service na koso and they say no an say per se ultimately no say obi oyare bia no obenya ayahwe intentem ayahwe nso so a high quality ayahwe nso so a nhia so kutiska hye botoman sana watimi aye eno ne ade a within the shortest time so no obenya sa ayahwe eno ne ade a nim so nya ni nyina nyama bebre ne ka boma no basa ba nya ni nyina na fi say ebebo ama apomden akoso nyama bebre wo ho a the good thing and say nipa na bi eko sika na atwom no ebia Africa had intimi enso ano ebia obi so bagbe obi say sika o ma no wuntimi ntua se ne wuntimi kasa je ntua koso nyama no na eni omo kasa incentive package abetimi encourage omo mo stay omo so a kakra na wa ha no auxiliary nurses wa ha no ye training omo sebe omo betimi nya I am more professional sebe ya e replace omo the good thing is say e will be 3 cohort of nurses amugufie enya mfa enti ye hope say e betimi nya ho kwan say ye hunu nipa na free mu a ye betimi de bi ahyem na numbers no ne be lose one say the quality na experience na omo wo no de kono and then be kakra ansa na etimi achikache yes ebedo ebe afam nyina ama bibia nso akoso okay.
Excellencies, members of the diplomatic corps, colleague MPs, I understand it looks like Dr. Kisi, you are the only one here with us today. The chairman sought permission. I've addressed the chair already of the Parliamentary Select Committee, the chief director, the ministry, agency heads, health sector lead, and all our development partners present. We directors and directors of all our agencies present, experts and resource persons present, distinguished virtual participants. I understand there are many of you, fellow health workers across the country, our media friends, distinguished ladies and gentlemen. Once again, we have gathered here to review our performance and redefine our health priorities for the next program of work for the sector. I shouldn't have been here, but after I tested negative for COVID 2 days ago, I gathered courage to join. And I just came to add my voice to also welcome our sponsors, partners, agencies, and health workers across the country for this all-important summit, the life of the sector, at least once a year. Indeed, your individual and collective contributions have brought us thus far in fulfilling our mandate as a sector ministry. Let me, on behalf of the government, express our special thanks first to the World Bank Country Director and his team for the massive support he gave us during our COVID experience. You're talking about timely delivery of resources to do work. And the first amount of money we got was good through the efforts of the World Bank led by Pierre. We wouldn't forget the Minister for Finance and the Parliamentary Select Committee. And they continue supporting us in terms of our resource mobilization efforts. And not very long ago, the country director mentioned it. The Finance Ministry, Parliamentary Select Committee, the ministry itself have gone through to be able to secure some loans approved by Parliament for the sector. These funds will greatly help to address the myriad of challenges facing the health sector post the COVID-19 pandemic, and more specifically, some good amount to help us actually implement our metric of practice that the chairman is advising, that we shouldn't cut it off to the health centers, but see how we can extend to join with the hospitals. I think that is good advice. Dr. Chair, we will look at it. Dr. Chair, ladies and gentlemen, in fact, the health sector needs more strategic funding to ensure the quality of life of our citizens, as well as ensure we have a better response and resilient health sector in the country. The year 2022 has been very challenging due to our current economic crisis. Despite the economic challenges, the health sector remained relatively stable in terms of our interventions and corresponding outcomes, and impacts. We have actually been put to test, but through what we did with COVID, in the process, we have fought and won how many outbreaks? These were mentioned, from Lassa, monkeypox, measles, yellow fever, Marburg, whatever. And we did that within a very short, reasonable time. It looks like our response is now a bit strengthened, and we are ready to look at what it is as we prepare to look at what emergency response strategies we can adopt facing the next things that we can see in our country. And Dr. Chair, when you were grading us, you didn't count our votes from outside. How the world now sees the efforts that Ghana is making in health. So if you add that one, we will get to the... Dr. Wadi has been attending the WHO Executive Board meetings. We remember until last week, and about a year now, I haven't been able to go. He represents us, and he hears what is there. In the last World Health Summit, those who attended can attest to the fact that we have gained some very good respect within the global health architecture. And we thank our President, the World Bank, and all our donors, especially those who have been consistent with us, our Global Fund and Gavi, over the years. 2022 saw a decline in the institutional maternal mortality ratio from 119.6 in 2021 to 102.6 in 2022. This, I understand, is very commendable. However, two regions, or three, Ashanti, Greater Accra, Eastern, these regions recorded high maternal mortality ratios. And I think there is the urgent need to support these regions to address the possible contributory factors. Institutional syllabus, neonatal, infant, and under 5 mortalities also reduced marginally in 2022. Family planning acceptance rates also saw an increase from 33.8% in 2021 to 36.1% in 2022. Our region recorded the highest family planning acceptance rates among the regions, and so they need to be commended. The regional director for AHAFO, let us clap for them. You've done so much. And I'll bring you and UNDP to see what you are doing there that can be extrapolated and that to be done somewhere else. These modest achievements, among others, are quite commendable, but we really need to do more to continue to justify for more funds. Distinguished ladies and gentlemen, I wish to reiterate that the government of Ghana is committed to achieving universal health coverage and increasing access to essential health services by 2020 and beyond. We believe that this commitment can be achieved through strategic investments in primary healthcare. Ghana remains significantly below the lower middle income countries' average allocation of 2.3% of GDP when we draw our international comparison of other lower middle income countries based on observed data from the WHO Global Health Expenditure Database. However, the proportion of the overall budget contributed by the government for the health sector has remained relatively stable since 2017, hovering between 59% and 62%, except in 2021, where it reached 64%. But you understand the reason why that was part of the heights of COVID investments. Donor funding has, however, been less stable. It reached 17% of the total budget for the health sector in 2017, but fell to just 6% of the budget in 2020, after which it rebounded to 12% again in 2022. That also has a reason. And I must emphasize and say that donor funding in the ministry now is so much so dry, virtually 0%. But when you get to agencies, we see some efforts being done by our donors. I think as we enhance and try to strengthen our efforts in domestic resource mobilization, though I know that donors are fatigued, but I think to help us achieve what we want to achieve by 2020, we may need some extra enhancement of their support to let us make sure that policies and certain legislations and things that we need to do to facilitate our implementing agencies are also quite in place. It is also important to highlight that the contribution from the annual budget funding amount of the overall health budget has also fallen from 1.2% in 2017 to just 0.3% in 2022. This is even recorded by UNICEF Health Budget Brief 2022. The theme for this year's Health Summit, Sustainable Financing for Primary Healthcare towards the attainment of universal health coverage, the role of stakeholders, is aimed at drawing the attention of government and all Ghanaians about the need to increase investments in primary healthcare management. Sustainable primary healthcare is a key component of all high-performing health systems, an essential foundation for universal health coverage, and a prerequisite for meeting the Sustainable Development Goals. It is a pathway to achieving good health at low cost by providing essential and cost-effective health interventions, including health promotion, maternal, newborn, and child health care, palliative care, immunization, and treatment of common illnesses across the life course. As the global burden of non-communicable diseases increases, primary health care is emerging as a locus of both prevention and the coordination